One of the biggest issues in patient care is patient history. And I've been involved in cases where patients haven't provided correct information, and since the doctor is in the business of diagnosing the patient, and since patient history is a vital part of that analysis, if the patient provides inaccurate or bad information to the doctor as far as medical history is concerned, many times that could contribute and lead to a wrong diagnosis. I call it the garbage in, garbage out phenomenon. Dr. Malone's here to talk to us today about how a patient can provide or is secure in providing adequate and good patient history, specifically related to pharmaceutical issues or medicines that the patient is on.
Yeah, and that's a great way to put it, Joe, is the garbage in, garbage out. And the way I like to think of it is physicians or care providers are only as good as information that they're provided. So one simple way that the patients can be their own advocate in providing the most accurate information, especially when they're not feeling well, if they're acutely ill, maybe they're not in the right mind, is to actually have this information written on a piece of paper or an index card, which can be kept in your wallet or in your purse. The information you'd want to have on that card would be the list of all the prescription medications or over-the-counters that you take on a regular basis, and the appropriate dose if you know that. In addition to that information, if that's all you could have, that information would do wonders, especially in the event that you are hospitalized, in the event that you aren't allowed to, or aren't able to speak for yourself. Additional information to have with that would be the prescribing doctors and or the list of subspecialists you see on a routine basis. Many times physicians and or nursing staff can kind of work backwards based on the name of the physician or the type of physician and try and figure out why you are on a medication. Some of the hot topic type medications are any anticoagulants, knowing why you take them, how long you've been taking them, and then some of the diabetes drugs, either the oral agents or the insulins. Knowing that information can do wonders for a physician, especially again when you're acutely ill.
That sounds simple. The idea of having an index card, and every time a doctor prescribes a new drug or increases a dosage, you either fill it out or have the pharmacist pull the card out at the pharmacy and say, would you mind writing down exactly what has been given to me today, and then put that index card in your wallet or your or heck, you could put it in your iPhone. Mm-hmm. And then making sure that when you see doctors or you're admitted, that you provide that information directly to the hospitalist or whoever's taking care of you at the hospital. Mm-hmm. That's good. That's good advice.
Yeah, and many pharmacies will have someone who's a patient advocate or a patient educator who will take care of that information for you if you let them know that you want that done. Also, physicians' offices should be able to take that short amount of time to update the card for you. It may not be your actual physician, maybe one of the nurses or medical assistants, but they're glad to do it.
Great. Thank you, Dr. Malone.